Hi, I'm Dr. Kim Carlucci from Montclair, New Jersey, and we are going to talk about headaches. Well, did you know that the ache and headache does not come from your brain? That's right, your brain cannot feel pain. During brain surgery, a patient is often wide awake and feeling nothing, even talking to the surgeons and the nurses while his or her brain is being operated on. They use a local anesthetic to numb the scalp and they go to work. So what puts the ache in headache? Well, it's the non-brain structures like the blood vessels, the membranes, and the cranial nerves in the brain and skull. When these structures are stretched or compressed, irritated, inflamed, or infected, headaches often result. So why has chiropractic been a blessing to millions of headache sufferers? The reason may be that most headache sufferers appear to be carrying around subluxations in their bodies. For example, one study of 6,000 long-term headache sufferers suffering 2 to 25 years with headaches revealed that neck damage like whiplash or falls was the most important factor in the course of headache and should be suspected in every non-specific case of headache. In a randomized controlled trial performed at the University of Odense in Denmark, those under chiropractic care decreased their use of painkillers by 36%, and the number of headache hours were decreased per day by 69%. This is especially important in light of our current opioid epidemic. This information was reported in the JMPT in 1997 in a study called The Effect of Spinal Manipulation in the Treatment of Cervicogenic Headache. So why is chiropractic so effective, and how does it affect the headache? Well, a team of surgeons may have found one of the answers to why chiropractic works so well. They discovered a small neck muscle that connects directly to the brain membranes. When the neck is out of alignment, this muscle can actually pull on the brain. As the lead surgeon writes, an increasing body of literature relates headaches to pathology affecting the cervical spine, and a number of clinical trials have demonstrated that chiropractic is valuable for managing headache. This information was reported in an abstract from the 15th Annual Upper Cervical Spine Conference, November 21st, 1998, called The Anatomic Basis for the Effectiveness of Chiropractic Spinal Manipulation in Treating Headache. Well, let's not neglect that headaches affect children too. For example, a 10-year-old with chronic severe migraine, which in her case meant 6 times a week for the past 3 years, was unable to go to school due to the severity of her condition. Neurologists, no one could seem to help her. A chiropractic examination revealed a subluxation in her upper neck, and after her 3rd adjustment, she was off her pain medications. By the 3rd week, she was back in school and had started dance lessons for the first time in 2 years and began to smile again. She was leading a normal and healthy life by the end of her 5th visit. That case study was revealed in the ICPA newsletter, January 2000. In another study, in the journal, the ACA Journal of Chiropractic, December 1998, a 13-year-old boy who was hurt in a football game was in terrible pain, had to wear dark sunglasses and earplugs to compensate for the increased sensitivity to sound and light. Sounds like a concussion. Well, medical doctors had given the boy painkillers and had him hospitalized in traction for 2 weeks, but there was no improvement. After his first chiropractic adjustment, he could ride home without wearing his sunglasses, and for the first time in 2 weeks, he expressed an interest in food. Although chiropractic itself is not a headache therapy, it can help with headaches. So anyone suffering from headaches should make sure that their spine is free from subluxations with a checkup from their chiropractor. I hope this information is helpful. I am Dr. Kim Carlucci, and as always, chiropractic brings out the best in me. Let it bring out the best in you.